Hi, my name is Mariah and I'm a therapist here at Ham Clinic, and I'm here for Mental Health Awareness Month to talk to you about depression and anxiety. There are a lot of ideas about what depression looks like. People might think that depression just looks like feeling really sad and having a hard time getting out of bed, and it absolutely can look like this. That is a very real experience of depression. And I want people to know that depression isn't a one-size-fits-all experience. The way that depression impacts you might be really different from the way it impacts somebody that you care about. Depression can also look like numbness and having a hard time being present to your life. It can look like disconnection and choosing to isolate instead of spending time with other people. It can also show up in really physical ways. So this might mean trouble sleeping, feeling sluggish and just not like yourself, or even having decreased appetite. And all of these experiences of depression are real experiences. Similarly, with anxiety, we have this idea that anxiety just means worry. And yeah, it does. It does mean worry for a lot of people. And it can look like irritability. Maybe there are things that bother you now that didn't used to bother you before. It can mean feeling restless and on edge. And it can also mean struggles concentrating, getting things done. This is all part of the experience of anxiety. And again, anxiety for you might look really different than it does for somebody else. And I want you to know that all of these experiences of depression and anxiety deserve support. If you are dealing with any of what I've discussed, it's almost always harder when you don't say it out loud. If you are not having the experience of your life that you used to or that you hope to, I want you to know that working with somebody who can support you and saying the heavy thing out loud so that we can hold it together almost always makes it more possible to move through this. And here at Ham Clinic, that's what we hope to do. We hope to accompany you in whatever your experience of anxiety and depression may be. And I want you to know that we're here to support you. Estamos aquí para apoyarte.